Hi and welcome. Thank you for joining us today. We are going to take just another minute or two to let additional registrants populate. We will come back on and begin in the next 2 minutes. Okay, let's get started. Good morning, good afternoon, and good evening. Welcome to today's webinar, Unpacking Vaccine Forecasting, Key Market Insights and Forecast Modeling Fundamentals. At Viscadia, we are passionate about empowering professionals in the life sciences industry with actionable insights and cutting-edge forecasting expertise. Today's webinar promises to be an engaging and informative discussion guided by our esteemed speaker who brings deep expertise in vaccine forecasting and market analysis. Let me quickly introduce myself. I am Casey Alexis, the Director of Marketing and Corporate Communications at Viscadia. I'm based out of our Washington, D.C. office, and I will be the moderator for today's event. Before we get started, let's get some of the housekeeping items out of the way. Please advance the deck. To run a quick audio check, we will be sharing a poll with you that you can access using the bottom right corner of your screen. Please select the yes option if you can hear me clearly. While you do that, some other things to keep in mind. The audio for attendees will be muted during the course of the event. We will be recording the webinar and we'll share it with you after. We will have time for Q&A towards the end of the webinar. To keep it interactive, please feel free to post your questions as and when they come, using the question icon also located at the bottom right corner of your screen. I will have access to those and will ensure that our panelists address them at the end of our webinar. Next slide. With that, it is my pleasure to introduce our speaker, Kritika Tokas, Associate Principal at Viscadia. With extensive expertise in strategic forecasting and analytics for the life sciences industry, Kritika has been instrumental in developing innovative solutions for complex challenges in pharmaceutical and biotech markets. At Viscadia, Kritika plays a pivotal role in collaborating with clients to deliver tailored insights that drive decision-making. Her experience spans vaccine and therapeutic forecasting, market analysis, and building robust models that empower organizations to navigate evolving market dynamics effectively. Next slide. A little bit about Viscadia. We are a specialized business management consulting firm exclusively focused on empowering the life sciences industry with clarity and confidence through forecasting. Viscadia was founded 14 years ago by Satish Kauta, a career-long forecaster. We have offices in Washington, D.C., Boston, Delhi, and we most recently established our first outpost in the EU in Lucerne, Switzerland. When it comes to forecasting, we believe there are 3 key pillars that empower our clients. First, we support market research efforts that help to drive the forecast. Examples include demand studies, conjoint analysis, buy process, and segmentation. At Viscadia, we believe all are core inputs to forecast models. The second thing we do is design and build custom models and platforms that help you across pipeline assets, DB&L assets, and on-market assets. And finally, our third service that we offer is cycle support. While some of our scopes of work are episodic, we also act as a trusted partner for our clients, offering support throughout the life cycle of a product. Some clients use us for their LRP process. Other clients use us for their latest estimates, their monthly or annual process, and we remain in their ecosystem to help them on an ad hoc basis as well. And now, I'll hand it off to Kritika, who will get us started.
Thank you, Casey, for this introduction. Hello, everyone. I am Kritika, and I will be hosting today's webinar on vaccines forecasting. There are two key agenda items that I would be covering in the next few minutes. First is the overall market landscape, the global landscape. And the second item that I will be covering today is the vaccines forecast modeling fundamentals here. To get started, vaccines plays a very important role in the overall industry. It plays a critical role in global public health and helps us in suppressing infectious diseases, thereby preventing communities from experiencing epidemics. We have recently come out of the COVID pandemic phase, which again stressed on the important role that a vaccine can play in saving millions of lives. Before getting into the details of the overall landscape here, I would like to recap a few stats stressing on the importance of vaccines in today's world. There were more than 12.7 billion vaccine doses which were administered globally in 2022. There were more than 154 million lives which was saved globally over the last 50 years since the stress of vaccines and immunization began in the globe. There are more than 4 million deaths which are prevented globally by childhood vaccination programs with the diseases like measles, tetanus, diphtheria, DTP vaccines. There has been one disease which has been completely eradicated till now, smallpox. It has taken a lot of effort over the last few years here. And there is another disease, polio, which is near eradication. We have seen more than 99% reduction in cases. There is also more than 80% reduction in the new cases for measles that we have seen in the last few years. If we look at today's vaccines global market size, we stand at approximately $80 billion. And in the next 10 years, we expect this $80 billion to grow to almost $150 billion. We are expecting a CAGR, a cumulative growth rate of 6.5% through these years. There are a lot of key players which are investing a lot in the vaccines R&D right now, and a very tight pipeline of products that we are anticipating. GSK, Sanofi, Pfizer, Merck, Moderna plays a crucial role in vaccine advancement right now. If we look at the regional distribution for vaccine sales right now, North America still holds a significant portion of the overall sales, contributing approximately 43% to the overall global market size. This is still less than what we see in a typical pharma sales contribution, which is between 55 to 60%, but still North America holds the majority share here. Following America, we have Europe with 28% share, APAC and the LATAM and African region at 23 and 6% respectively. The major distinction that we see in the regional contribution versus a traditional pharma drug forecast is just the overall split here. North America and Europe combines approximately 80% of the overall worldwide sales for any pharmaceutical drug. However, for vaccines, there is a lot of importance in what APAC and LATAM region can play. Vaccines has not been investigated in the last few years only during the COVID era. There has been efforts being put in for the last few centuries. 1976 was when the beginning of vaccines investment and the importance of vaccines came into the picture, when the first vaccine for smallpox was developed. In the last 100 years, if we see, There were initial developments of whooping cough, diphtheria, the DTP vaccines, which we talked about, which has reduced more than 80% of cases today, was set up back in 1920s. It was followed by the influenza vaccine, the polio vaccine, which is again near eradication right now, followed by MMR, smallpox eradication, and HPV vaccine. In the most recent year, Ebola and COVID-19 vaccines has definitely played a significant role here, saving millions and millions of lives. If we look at today's world, sharing some stats from 2023, BCG, DTP vaccine, Hep B, measles, polio, HIV have more than 70% coverage globally. To achieve herd immunity, the governments target at least 90 to 95% coverage globally. But still, BCG and DTP and measles hover somewhere around 85 to 90%. We see lots and lots of variations across different regions in terms of how these vaccine coverages spread between the high income countries and the low income countries here. Taking a few examples here. For HIV, which is the Haemophilus influenza type B vaccine preventing meningitis and pneumonia, the overall global coverage for 3 doses is approximately 77%. But Europe, coming in from the high income countries, provides more than 94% coverage here, whereas the Western Pacific region, comprising of Asia and some of the other regions, it holds less than 33% coverage. Similar is the case for pneumococcal vaccine. Even though the overall coverage is approximately 65%, Europe holds a major coverage targeting at least 86% of the population, and Western Pacific less than 25%. Same is the case for HPV vaccine as well, which has come across as an emerging vaccine in the last couple of years. With lots of government initiatives and policies focusing on the importance of HPV vaccination for females and males as well, we see only 10 to 20% overall coverage at a global level right now. US is leading the trend with more than 60% coverage, but for the rest of the world, the stats still remain less than 10% here. There are lots of reasons which can affect the vaccine coverage overall. There could be hesitancy, journal hesitancy, knowledge awareness gaps here, or some of the more infrastructural reasons that could impact the vaccination coverage are related to access and pricing. High priced vaccines are difficult for some of the lower income countries here. There could also be religion biases, geography barriers, or political policies which determine the overall vaccination coverage for any given disease or indication here. To understand more in terms of how the vaccination coverage could evolve over time or what are the driving factors for low or high vaccination, a detailed, in-depth market research study could also be conducted to understand the sentiments and the market analysis here. As of 2023, when we are still coming out of the COVID pandemic, Comirnaty still holds the maximum share in terms of the overall revenue for vaccines market. It is very closely followed by HPV, pneumococcal, and shingles vaccine here. Some of the other vaccines which are still playing a major role in terms of the top 10 product categories are diphtheria, RSV, and varicella here. Some of the growth in revenues that we have seen in the recent time is also because of shift in technology and shift in preventive and routine vaccines here. There is a lot of stress in terms of in providing the catch-up schedules for HPV vaccine. Even though it is recommended only for girls right now between the age of 9 and 14 years, there are specific catch-up target programs being formulated by different governments to cover maximum population here. COVID time has given a boost in terms of the technology industry. mRNA technology has boosted a lot in terms of the R&D investment that different companies are investing for different indication. We are seeing a very crowded pipeline as we are moving forward here. If you look at the overall vaccines market landscape, right now, even the COVID is the one which is leading the market. There is an expected shift as we move in the upcoming years. Hepatitis, pneumococcal, influenza, and RSV are the highest growing sectors that we are looking at. We will continue to see growth and revenues from the other vaccines like DTP, MMR, rotavirus as well. But the maximum growth that we are looking at is in hepatitis, pneumococcal influenza, and RSV. There are also lots and lots of mono, combo, and triplet vaccines being investigated at the current time. Like I said, vaccines market projects a bright future in the industry with signs of continued development. There are multiple factors contributing to it, just the advances in the mRNA technology, other types of vaccines here, and also the focused effort by governments and the pharmaceutical industry in promoting vaccines, just understanding the overall global health. There are more than 100 assets, more than 100 vaccines which are expected to launch in the upcoming 8 to 10 years here, and there are more than 200 pipeline products which are being investigated at present. Some of the key products that we are looking at right now in the market are from oncology, viral, and respiratory tracts. I hope the overall, with the last section, we got a glimpse of why vaccines are important and the kind of evolution that we are seeing in the industry at present. Now, to project what could happen in this vaccines world, understanding the modeling fundamentals becomes critical. Before getting into the details of it, we need to understand why vaccines and its forecasting is different from a traditional pharma drug forecasting. There are different factors in not just how the vaccines work, how the mechanism work, and how the R&D process and approval processes are different, but also once the vaccine is launched, how does it target different population? For typical pharmaceutical drugs, which are given to patients who are diagnosed with the disease, a vaccine can also be given to a much broader population, which includes healthy individual as well. Even though right now there's a focus on a lot of cancer vaccines as well, which are more therapeutic in nature, but still, most of the vaccines, the childhood vaccination programs which are which are developed for different regions, are all focused on healthy individuals so that the disease can be prevented. Second key important factor that's different for vaccines is the recommendation schedule. The vaccine's recommendation schedule formulated by different governing bodies across the regions plays a critical factor and is determined often by the population immunity, disease prevalence, and the overall public health data. Uh, Taking an example of again the HPV vaccine here. For US, it recommends it for girls for age group of 9 to 14 years with some specific catch-up cohorts as well. Whereas if you look at some of the Asian or some of the African regions, the recommendation schedule varies based on where the population can be targeted. For some, it's just restricted to 9 to 10 years. For some, it's restricted to 15 to 16 years. For some, it varies between the adolescent age group here. Third factor that differentiate vaccines from a traditional drug is the segment tracking here. It becomes absolutely critical in terms of tracking how many people are aging in and aging out of the eligible pool. Like we talked about, there's a short uh, targeted age group based on the recommendation guidelines by different groups. It becomes very important in terms of how many people get added to that eligible pool every single year and how many of them move out of that pool. And it determines the model design and methodology as well. Along with that, there are other complexities associated with vaccines forecasting. It's about the dynamic element of tracking different types of vaccination. It could be the routine vaccination, it could be the catch up vaccination, the number of doses, first, second, third, booster doses here. Or it could also be the complexity of tracking the manufacturing and distribution factors, wastage, shipment time, what is the expiry date for different vaccines. And we have seen that just determining and understanding some of these factors could play such a huge role. Going into the type of vaccines forecasting model, like I talked about very briefly on the last slide, there are two types of vaccines or two types of vaccines that we could look at. One is the prophylactic vaccines, which is prevention against the disease, measles, diphtheria, cholera, pneumococcal, HPV, flu, COVID, all of those. And the second type of vaccines is the therapeutic vaccine, which is more when the patient already has the disease and that vaccine is given just like a drug to treat that particular indication or disease type. The methodology and the design of forecast model differs across the two. For prophylactic, there are two types of model that we could look at. One is for the lifetime vaccines, which are like once given and dusted, which is, let's say, the pneumococcal vaccines or diphtheria vaccines or measles, which are given during childhood vaccination programs as well. And the second could be the period coverage, which is once the vaccine is given, it protects you for a certain period of time. Flu vaccines, as we see in the US industry, it's a seasonal vaccine. Before every flu season begins in September until the next March, there are specific guidelines in terms of how the flu vaccine should be formulated, which variants are expected to be more prevalent in the coming season or not, and it protects you for the entire season. And next year again, you'll come back and get the flu shot, and you get going. For period coverage, vaccine, like we're talking about, revenue typically increases over time, and then there could be based on the product life cycle or the coverage period, which could be 1 year, 2 years, or 3 years as well. For certain cases, we may observe certain cyclicity or seasonality in the overall revenue. However, for depleting eligible pool, the maximum revenue, the maximum potential that a vaccine could get is in the initial few years when the entire population is eligible. However, over time, that population will keep on depleting and it would stabilize over time. The second set of models that we were talking about, the second type of vaccines, therapeutic vaccines, I think these could be very similar to the traditional pharma drug forecast models that we create, a patient-based or a patient flow vaccine. And the overall revenue also typically is governed by the unmet needs in the market, the product positioning, its competitor, what is the pipeline, and how things are expected. Sharing some details in terms of the depleting eligible pool of the model, like I talked about. The maximum revenue potential is at the start when the vaccine is launched itself, because the entire population that we have is eligible for our pool. However, over time, when we say that certain people keep aging in, certain people keep aging out, and we get a stabilized pool, but there is another set of patients which gets excluded from our eligible pool, which is the population who is already vaccinated. If we look at the polio forecast or polio revenues today, that is only and only determined by the unvaccinated aging in population, basically the new births that we see across regions every single year, because the prior population has been mostly vaccinated against polio, and that's why we say that the disease is near eradication. And post-launch, like we talked about, the maximum revenue potential is only and only determined by the unvaccinated aging in population. The overall eligibility and the revenue potential for period coverage models differs slightly from depleting population, and the tracking gets a little bit more complex here. Let's say there's a flu vaccine, or let's say a combo vaccine for COVID and flu, which gives you a period coverage of 2 years here, right? So before launch, definitely before any such vaccine enters into the market, entire population is vaccinated. Then at launch, you will continue to track the unvaccinated aging in and the previously vaccinated population, like we talked about in the depleting population. But after a period coverage of 2 years here, there would be additional population pool that will become re-eligible for vaccination, which is the previously vaccinated pool. So every time you have to keep track of 2 to 3 different types of population pool here, which is the unvaccinated, previously unvaccinated as well, and previously vaccinated as well. And this previously vaccinated gets added to the pool after that period coverage. It could be 2 years, 5 years, 1 year, 6 months, anything. There are other key considerations for while you're forecasting for vaccines here. That is the recommendation label. Eligible pool is the starting point for our for vaccines forecast, and determining the correct eligible pool will will be the fundamental for any forecast here. Managing segment level complexity, whether it's a mono vaccine or a combination vaccine here, or whether it's about the channel distribution between the public players and the private players in the market, or different types of classes of vaccine here, it can become very complex very soon. Third thing is the tracking of dynamic potential pool here, age cohorts, routine, catch ups, everything there. Like we talked about in the model design types, the depleting population pool and also the period coverage pool, the dynamic tracking becomes more and more important. And with some of the regional nuances, additional levels of tracking will come into the picture. Third is the fourth point here is the market share and understanding the impact of order and time to peak. Like a typical pharma drug, wherein based on Zipf's law or other laws as well, we say the first product to market has the biggest advantage, and then the second, and then the third. Vaccines that market dynamics vary slightly here. And then last but not the least, provisioning for regional nuances while creating global forecast. The recommendation, the pricing, access could vary significantly across different regions. And like we talked about at the start, there is significant contribution from APAC, LATAM, African, Europe, and US regions here, which comprises of the global forecast. So in order to get a robust forecast, we need representations from each of these regions before the overall roll-up. Recommendation. There are different types of recommendation which are given. Age-based recommendation, like the HPV 9 to 14 years for adolescent females here, or let's say for pneumococcal as well. There's a 4-dose recommendation schedule as per the US government websites, and there are also some risk-based cohorts which are recommended for pneumococcal vaccine, which is all the older population above 65 years of age, and also adults with between 19 to 64 years of age, but with certain risk condition, chronic heart diseases, hypertension, some of those factors. So understanding the different government guidelines, the different recommendation schedules as prescribed by different governments is very important in determining the eligible pool. Now the question is when to vaccinate. One is the routine vaccination, which is most of the childhood vaccination programs, TTP vaccine or HPV vaccine, which is coming into the picture right now, or pneumococcal right now. There are catch-up cohorts as well. So to boost the HPV vaccines in the market, there are separate catch-up cohorts which are being formulated by different governments right now for women aged between 19 to 45 years as well. And then there could be certain occupational or traveler vaccines. If the people are traveling to a place which has higher risk of developing a disease, let's say yellow fever or cholera, they would be recommended in terms of when to get vaccinated here. Model segmentation. Model design, like I said, can become very complex very soon, and it's absolutely important to understand which segments are important for addressing the key business questions as you're developing the forecast. If you want to understand the type of share shift you see between different vaccine types, if there's only live attenuated vaccines right now in the market, and there are mRNA or viral vaccines which are coming into the picture, and you want to see the shift or potential shift here, understand the market dynamics in terms of share theft, segmenting your market model by technology type or by different classes will become important. You can again run the market research, understand what the population, what the different pairs are feeling, the parents are feeling here in terms of the safety and efficacy of different vaccines. Another important factor that becomes is the composition, mono and combo vaccines here. Mono vaccines like a single flu shot or a single COVID shot here. Now with the recent advances in technology, a lot of R&D being done for combination doublet or triplet vaccines. Doublet for, let's say, COVID plus flu, or triplet for COVID, RSV, and flu combined vaccine. It just becomes easier in terms of the route of in terms of administration, ease of administration, and convenience of the population as well. But in terms of modeling, the shift between mono to doublet and triplet over time as they become available in the market becomes critical. And here, not just a single indication model will work, but creating a market model with all different indications and transitioning the eligible pool from the individual indication population to everything combined becomes important. Another piece is the route of administration. If infrastructure becomes a critical piece in determining the coverage and the potential for your vaccine here. Other segments that could be critical for any vaccines forecast is distribution channel. So public players right now dominate the vaccines industry across the globe here, but there is also an emergence of many different private players that play a critical role here. So understanding the differences, understanding the pricing and access across the two here will be important. There is a third type of distribution channel as well, which was more prevalent during the COVID pandemic time, and that was contract based. So the overall market share and demand, there was a lot of imbalance between between the market demand and what was the manufacturing capacity of different vaccines in the market. A lot of share was determined by the contracts being negotiated with different governments here. And I think once the big contract being negotiated, I think the entire share and the entire market dynamic shifted towards that drug. Last but not the least, end user in terms of the person who was getting vaccinated. That also becomes a critical segment for vaccines forecasting. For many vaccine types, understanding what is your eligible group or how people shift across different age cohorts becomes important. Let's say I was talking about HPV earlier, right? So recommendation or routine vaccine is for 9 to 14 years of age, but then there are other age cohorts as well, which are the catch-up cohorts, which is 18 plus or 16 to 25, then 25 to 45 years. So segmenting your market, segmenting your model in a way that you're able to track the potential opportunity across all three of these becomes critical here, because the catch-ups schedules are only for a limited time and the routine vaccination continues over a longer period of time. At any point of time, I would still recommend not segmenting your model in more than 10 to 12 segments, because it becomes very difficult to get the information, get the assumptions, and continue to track your forecast at this granularity. But it again depends on the business question, the area that you're trying to solve for, to determine which will be more critical for you. Market share. Like I said, for depleting, let's say, for depleting population models, right? The initial few years just after the launch becomes the most critical with maximum revenues for the vaccine here. And if there is any competitor launch during that initial phase wherein we have a lot of unvaccinated potential in the market dynamics may change. However, if the next competitor is launching, let's say after 5 or 10 years, till then, the maximum revenue would have been gained by the first to market vaccine here. Similarly, we need to keep track of duration between the launches and how it impacts your catch-up cohorts, your booster vaccination, if a shift between the first dose and a second dose is allowed or is not allowed, and other factors. Other factors which impact market share overall is also contracting and portfolio dynamics. We talked about this in the last slide as well. Contracting, if there's a government contract negotiated, I think it can alter and it can impact your market shares altogether. Large differentiation in launch product profile can also alter the market dynamics significantly. Example here is the mRNA technology, the vector platforms which are being investigated and which are the norm today. mRNA technology has significantly reduced the time in bringing vaccines to the market here. And with that, the pipeline launches can be accelerated a lot and can play a critical role here. Coming to the global vaccines forecast model, like I said, there has to be a balance between the geographies from all income group, high income group, middle income groups, and the lower income groups as well. Some of the key geographies that we typically forecast while creating a global vaccines forecast is US, Canada, some of the EU5 regions, Japan, South Korea, Taiwan, and China. There are different governing bodies which determine the recommendation schedule for, let's say, ACIP, NACI for Canada, CTB for France, STIKO for Germany, and so on. There are also government players. There are different governing bodies which play different roles in terms of determining the reimbursement and pricing factors for these. For most of the LATAM and South Korea and some of the Asian countries, pricing and access plays an important role in terms of the vaccines distribution and access as well. Just a quick summary in terms of how to best create a vaccines forecast model. I think we talked about a lot of things today, understanding the overall market landscape, types of model here, key factors influencing the market share, the segments, the recommendation. Summarizing that in a few key steps whenever you're creating the forecast is understand what is the model design and structure. What is the indication that you are forecasting for? Does it require a period protection or a depleting population model? What are the level of segments that it requires to address key business question? Do you require a single indication or a market model? Second thing to understand is the granularity and horizon. Do you need an annual long range model, just understanding, taking some key R&D or BD decisions here? Or do you actually need to track the manufacturing, the supply chain, the wastage, and everything related to it? What are the geographies that you want to consider here? If you're creating a global, considering at least the top 10 to 12 key geographies becomes important. And last but not the least, the forecast assumptions that determines your overall potential for the vaccine. For top line epidemiology, publicly available data, the population stats, growth rate. For vaccination coverage and eligibility, the national government websites, which have the recommendation schedules. You can also conduct some of the research in terms of evolving immunization coverage overall, shares, the class dynamics, cannibalization across different sections, and lastly, the conversions here in terms of dosage, single dose versus a booster dose, or the wastage factor, pricing access, and the distribution channel level GTN factors. So that was it for today. I think we talked about a lot of things here. I hope it is you have gained some insight in terms of how to start with the vaccines forecast. In case you have any queries, do reach out to the specialist and understand the details and the critical aspects that would be required for creating a robust forecast. With that, I hand it over back to Casey for any Q&A, for any questions that we might have received till now.
Thank you, Kritika. We now have time to field some questions that have come in from our attendees. As a reminder, all are invited to submit your questions using the question icon on the bottom right of your screen. The first question we have today is, how is vaccine forecasting for pandemic, epidemic situations like COVID different from what you talked about today? Kritika, I believe you're muted.
Okay, sorry. Thank you for that question. I think the vaccines forecasting for pandemic and epidemic situation varies greatly than what we typically do for a long range forecast plan here. And there are several factors to it. One is the rapidly evolving environment, rapidly changing environment. Just going back to the COVID days in 2020 and 2021, every single day we had a lot of new information in terms of what COVID is, how is it evolving, what type of vaccines are available in the market, and every new day there was a new recommendation, new guideline. Your forecast model has to be dynamic and adaptive enough to accommodate all of those changes. It has to be quick, it has to be simple. If you take, let's say, 6 to 8 weeks just to create the most robust and most detailed forecast model at that time, till that After 8 weeks, situation would have changed completely and you'll land up with nothing. Another factor that could help in terms of determining the pandemic and epidemic forecast is keeping a track of the recent trends here. Every with COVID trackers, which are live in 2020, 2021, and 2022, I think a lot of good information was available. Number of cases diagnosed, the kind of challenges faced here. So I think it's very important to continue with those trends. So you definitely need to keep an eye out on what is expected in the next few weeks or months, depending upon the situation here. And then it's also important to keep track of what is happening today.
Thank you, Kritika. The next question, how does vaccine manufacturing and distribution impact the forecast? At what stage should it be considered in the forecast?
All right. So vaccine distribution and manufacturing should come into the picture just before launch, but the granularity may vary. So for a typical pharma product forecast as well, we typically bring in the manufacturing and distribution aspects at, let's say, launch 1 or 2 years before the launch, like near phase 3 completion trials here. Similar can be the case for vaccines as well. For just before launch, 1 or 2 years, we can start incorporating the wastage factor into the picture. We can start factoring in the shell life of the vaccine as well. And once the vaccine is launched in the market, I think there are many other factors which would come into the picture. The shelf life, how many are getting wasted here? Were we considering a very long shelf life? Is this an opportunity lost, or is this an opportunity gained for the pipeline drug as well? Because if we fall short in vaccines here and there's a new competitor within this next 1 to 2 years here, it is an opportunity lost for us and an opportunity gained by competitors here. So the granularity in terms of incorporating the distribution and manufacturing aspects, it changes, but it should be incorporated after the launch.
Thank you, Kritika. And we have one last question that just came in. What are the key factors impacting vaccine coverage across regions?
Right. So I think vaccines coverage, we covered a section on vaccines coverage earlier in the webinar as well, but there are lots of factors that could play a huge impact on overall coverage. We have seen despite significant effort by different governing bodies, different NGOs, WHO, we see varying trends across different indications. And it just becomes difficult in terms of pinpointing a single factor. There could be the macroeconomical factors in terms of the access and pricing of the drug. So HPV vaccination, 60% in US even today, even it was just launched just a couple of years back, but significantly high. Versus for the rest of the world, it's still less than 10%. It's because of awareness. It's because of lack of infrastructure here. It's because of the government policies as well. For US, it's still mandated, recommended strongly. Maybe for some of the African, Asian regions, it is still not included in their recommendation schedule. Some of the other factors, despite macroeconomicals, can also be the religious or the social beliefs as well. We have seen a lot of pro and anti-vaccination drives in the US and some of the other regions as well that tend to influence people. Now, it could be lack of awareness. It could be just their religious beliefs as well, or it could be certain other factors. So I think based on the different indication, the reasons vary in terms of the coverage and the factors impacting it. But I think in terms of a detailed research study can be conducted in terms of understanding the sentiments that influence a particular indication type.
Thank you. I don't think we have any other questions that have come in, so this marks the end of our webinar. Thank you all for joining us today. If you have any further questions or would like to continue the discussion, please don't hesitate to reach out to us. And stay tuned for more exciting webinars and events from Biscadia, focused on forecasting within the life sciences industry.